I can confirm the webcast has started. So feel free to start.
Marie. So welcome everyone. If we go straight into it, I don't actually think this meeting is going to take very long because I think it's all fairly positive, good stuff. So Stephen, do you want to take us through the first one?
Yes, of course. Thank you. So this is a paper regarding the decision for an extension to the current social inclusion service contracts. There are two recommendations. The first one being that approval is given to extend the social inclusion contracts through modification for a period of 12 months until March 2023, and give approval for the associated spend of £2,254,872. And a related second recommendation that approval is given to grant £428,509 to Basingstoke and Deane Borough Council for the delivery of social inclusion services in that area for the same period of up to 12 months until March 2023. So the social inclusion services are housing related support services for people over the age of 18 who are homeless or at risk of homelessness. These services are largely delivered through sort of three levels of service intensity. There's an intensive 24/7 supported housing and night shelter services, some lower level move on supported housing, which again is 24/7 service, and a community support type services. The housing related support services are, as I said, are people for homeless or at risk of being homeless, and are commissioned in partnership with our district and borough council, district and borough councils to help meet their statutory responsibilities. Due to the pressures placed upon adults' health and care as a consequence of the COVID-19 pandemic, previous plans to review and retender these services and for new contracts that were due to commence in April 2022 have had to be reconsidered. These services cut across a number of across the agenda a number of statutory authorities, say including districts and boroughs and the CCGs and Hampshire County Council, which means it's important to make sure that we give sufficient amount of time to make any kind of review and retender of these services right. Therefore, hence the request for an extension of 12 months to give sufficient time to allow a complex review and procurement process to take place. These services will be extended under exactly the same terms and conditions as they're currently delivered at the same financial level, and the process agent does not represent an additional cost compared to existing spends. And I would commend the report and open for any questions.
Thank you, Stephen. Can I just ask a question I've often wondered about? I mean, about 5-6 years ago, we started giving Basingstoke a grant so they could do their own thing.
Yep.
Have we ever analysed whether the service they provide, just by giving them the money and letting them do it, is better or worse than what the districts and we do?
Yes, in as much as the service they provide is almost identical. They use the same service specification, the same sort of performance indicators. It has in a number of areas potentially allowed them to put in a little bit more of their own funding and to potentially pull together some extra services from their perspective. But in terms of the service that we're specifically looking at here, the evidence seems to show that there is it's not better or worse. It's just a different delivery mechanism.
Okay, that's fine. Thank you. Right, Councillor Withers.
Chair, I fully endorse the proposals. It makes sense, and obviously due to COVID and it being, delayed to March 2023 on both proposals, it makes sense to approve them.
Thank you. Councillor Brigg.
Thank you, Chairman. No, I agree with the proposals. Thank you.
Thank you. And Councillor Tuston. Are you from Basingstoke, by the way?
Yes, I am. Yes, I am. Yeah, I have no objections for these. I approve these as well.
Okay. Well, thank you very much, Stephen. Thank you. And we will approve. Oh, actually, I should just tell Jennifer that I have read all the legal advice, and I realise that there might or there is a possibility of a challenge, but highly unlikely. Would that be correct, Jennifer?
The report refers to the legal advice being in the exempt appendix.
Ah, sorry, my apologies. Okay, right, we'll stop that then. Okay, thank you very much, Stephen.
Yeah, Fran's got a question
That's
for
Fran,
you.
sorry.
That's all right, don't worry. I wasn't sure if I put a hand up or you were just going to ask us. I wasn't sure. Yeah, just a couple of questions actually. When this contract is up, will it be obviously this is carrying on, still linked to the COVID provision, I would presume, same sort of service level or whatever. At the end of the contract, what will happen? Will it be reassessed? And I just wondered also if any of the services, any of the districts there, that they're called lots, so I don't know which one is which on our paper, are any of them not operating as well as others? I presume that they're all operating well, because I'm sure you've got a handle on assessing them all and keeping an eye on them.
So in relation to your first question, in terms of any sort of assessment and working out what happens afterwards, that's the plan for where this extension comes from. So over the course of the period between now and when the contracts would come to an end, that's the process that we would go through. As you know, as the paper says, we work very closely and aim to continue to work very closely with our district and borough council colleagues to assess what is being delivered, how it's being delivered, whether any changes are required. So any futures, if we were looking at any changes to that at any point in the future, obviously that would come through the same, come through a process as before. In terms of delivery, there are geographical differences, just partly based on where some of these services are based, but by and large they're all operating in very similar way. We have regular contract monitoring meetings with the providers. They supply regular sort of 3-monthly and annual responses in terms of who they're working with, the needs of the individual they're working with, how that's being delivered. So we have, as you say, we have quite a close and tight view on what's going on in terms of the delivery of that.
Okay, thank you, Stephen. Happy to approve the recommendation.
Fantastic, thank you.
See what happens next year. Thank you. Yep. Right, Peter.
Thank you. So I'm here to discuss the paper regarding demand management and prevention grants. And the recommendations in this paper are to approve the award of grants totaling 42,758 to cover a year period between the 1st of September and the 31st of August 2022 as part of the Local Solutions Grant scheme. We give grants as to voluntary and community organisations because we know they provide a valuable locally based service for individuals and they're very much rooted in the communities they serve. This provides a significant benefit for the individual and helps avoid and prevent and provide alternatives to social care by targeting those most at risk of potentially becoming into the social care arena. The local solution grants are very much services throughout through this locality approach. We work with the applicants to ensure that the applications both meet the needs of their local community, which we look at demographics and other indicators of that, plus also our intelligence and working with partners, but also how it links into the demands on social care from the area, but also those bigger risk factors we're aware of in terms of that. And very much the provisions are there to kind of either build provision and expand capacity to a new area, or to trial a new initiative or innovation which we want to test to see if we can, by putting something in that local level, we can then look to see if we can scale or spread that to another area by giving these smaller grants rather than the county-wide grants we give at other points of the year. The 3 grants we've got in the award today, there's 3. One is for Basin State Voluntary Action, which is a grant of 13,000, and that's for their IT rebate, which is looking scheme, which is taking an idea which has worked again in another part of Hampshire, in Hart and Rushmore, to look at how they can repurpose old IT equipment to give it to people who may have not be able to afford IT access up to that point. We know that during COVID particularly, we've had a cohort of people who haven't been able to afford that, and actually there's a correlation with being the most vulnerable in our society, and also more likely to require social care, whether that be older adults or may have learning disability, physical disabilities, or mental health issues, and very much it's looking to support that. Also, we recognise that those who are digitally excluded can often the issue they can have is by not having that enablement for digital, they have less access to information and advice, which actually has been really crucial. And we've seen a difference between those who've been able to access that support via online means, via those who haven't during the last year. And we want to kind of look to expand that and recognise that development as we move forward by making sure we can provide equipment in this way through these partners. The second grant is for MHA communities to deliver a connector service in the Alton area. This builds on existing services they do operate in this area, but looking for a different sort of cohort of people, not for existing members, but almost to provide a drop-in service so older adults seeking support can get advice on a range of issues, as well as looking to connect them to local provisions that be provided by MHA or other providers out there in the community to look to tackle issues of social connectivity and reduce the issues of social isolation and loneliness. The third is for Yardley Community Association, which is looking to provide a range of fitness and wellbeing activities within a new community sports facility, which has received funding from other sources. This is very much targeted at older adults, again, recognising that the benefits of physical exercise can have on well-being, particularly in areas such as prevention of falls, or at least the impact that falls can have by strengthening bones and the like, as well as providing that social aspect, which again decreases the risk of social isolation and loneliness, which we know has a big determinant in terms of your well-being and can lead to that loss of well-being, if it's not addressed, can lead to issues and requirement of social care. So they're the 3 grants we've got in the paper today.
Super, thank you, Peter. I'm afraid I broke up and I got lost halfway through. I'm back now, but it says my video is not working, so I don't know. Was I the only one who broke up, or did other people have problems halfway through?
I believe you left and came back. You're on video now.
I'm on video now, am I? Oh, good. Peter, can I just ask you, do you look after the Getting Going Again grants as well? In
part, yes. Our team is administrating that, but equally the management sits within the self-isolation and our COVID response. But we're very much involved in that.
Good. I just wondered if any of these organisations had applied for that as well. Because a lot of the aims are very similar, aren't they?
Yes. So we've that grant has been open for 4 weeks now, and we have received several applications at this stage. One of those I know has come in is from one of these organisations, and we have spoken and promoted it to all our grant funded organisations, as well as wider to all organisations we know via the voluntary sector community and also local district partners. Being sort of 3 to 4 weeks into that new grant, sometimes it takes a while for organisations to kind of put applications in because they want to consider their response. We'd certainly welcome applications from many of these people. As I say, we have received one already, which is to be considered for funding a panel in the coming weeks.
Okay, thanks. I just wondered, because I know at least 2 of these organisations have actually applied for councillor grants. And actually, I've been sending them back saying, try the Getting Going Ahead, because it's the same, you know, that's basically what they want to use it for. And Getting Going Again can give them a lot more money than a councillor can. So sure. We'll see what happens. But anyway, I'm very happy with these grants. Councillor Withers.
Peter, I fully support the grants. One of the things that's cropping up in my division at the moment is the day centres are beginning to get back together, and obviously building to start all their activities, potentially, you know, getting their dementia cafes, but also the elderly into the day centres for, you know, grooming and hairdressing. Does this cover any of those sort of activities with the day centres coming back into being?
On the
Or-
whole, that is funded. That is funded by our commissioning element in terms of department, rather than and through contractor services rather than via a grant. However, there are some, especially some services we provide under grant, which may link to that, or they can refer into, such as dementia support services or support for carers, which would very much be open, but aren't necessarily, they're not themselves day sort of care provision.
Yeah, I mean, in Farnborough and Aldershot at the moment, with the regeneration, a lot of the community halls and buildings that we used previously obviously have disappeared. And therefore people are starting in new premises. So I just wanted to make sure, whereas, as I've said, I support the grants here totally, it's thinking ahead again of what's coming out of COVID and what people are trying to do, and ensuring, particularly when you're talking about IT here for the elderly who aren't IT literate, there's a great opportunity in those centres to actually do some training.
Yes.
Yeah.
But no, I
I
fully
see Graham's
support
got his
it.
hand up before I
Yes.
respond.
Graham, do you want to come in there?
Yeah, thank you. I think it's a really key point, and of course what we've got is a variety of, as Peter has made mention of, commission services, and then we've got that local need that may be identified locally. So it's people that may not have, for example, been in contact with us in terms of social care eligibility, but there's a need for some befriending or some practical support. So what I would say, Councillor Withers, is Peter and colleagues are more than happy to respond and have conversations, because not only have we got these local solutions grants, as Councillor Fairhurst has mentioned, we've got the Getting Going Again fund, and we've also got our duties under commission services. So potentially there are 3 legs on this stool, and any one of them, or indeed all 3, might be possible to make available to local groups depending on the demographic they're supporting.
Lovely, thank you, Graham.
Councillor Carpenter.
We had a really good community agent in one of the villages near me, so I do know the value of community agents as such. Unfortunately, ours is gone now, but that's beside the point. I just wondered, how do people find out about these services? Are the organisations working with people as social prescribers at GP surgeries? Do they know about these organisations? And also, how do we know that the money and the organisation that we are contracting as such, or given a grant to, have actually saved us money from care costs?
So in terms of the first question, in terms of how do we link up with other services and how do people access those services, when we look to award, we communicate out who we've made the award to, not just to our community teams, but also let local partners know. In terms of other aspects of our team provision, in terms of DOM and prevention, we do very much work closely with sort of the primary care networks and especially the social prescribers. And we will let them know in those local communities about this provision, recognising that often they see people at that early stage, and actually if they can divert people or help people into these services, it can then divert them requiring social care at that later stage. In terms of that second point, I have in my team dedicated officers who look to respond and work with these organisations to monitor activities. Not only do we have outcomes, but we also have regular monitoring meetings to test and to see what their outcomes are and what the benefits are. And that includes a range of indicators, from both quantitative indicators in terms of number of people, as well as how the impact it's had on those service users, quality of lives, maybe from they score often their social isolation, how less lonely they feel from being part of those groups. We can see that measure in terms of that, but also for more qualitative case studies which they provide, as well as my officers going in and seeing that. In terms of how that reduces social care, because like any early intervention, it's often hard to see what difference it makes or what could have happened if that wasn't in place. However, so in some ways there's a little element of faith. However, what we do in our team is then also look at other studies which also go on nationally. There's a lot of academic science networks which are going on which support that work, such as we know, for example, that I know it seems like a trite statistic, but social isolation can have as big an impact on individuals' health and social care outcomes as smoking 13 cigarettes a day. And they've kind of done that from a quantified from matrices. So we can see, but if we're looking from those, say, going back to that quantitative work we've done previously and seeing that reduction in that social isolation, we can have some knowledge about impact and what cost that could have had to social care if that about loneliness hadn't been addressed.
Thank you. Thank you.
Okay, Graham.
Yeah, again, just to follow up, it's that really thorny issue about potential cost avoided, and how do you possibly quantify the thing that didn't happen? So, as Peter has said, to some degree, it's a managed leap of faith, but we do know, based on a wider set of data and evidence, that preventative approaches have a generally good return on any money spent. So the investment is well founded. And from a slightly harder edged perspective in terms of social care spend, we know that even if we're reducing social care spend for a day, a week or a month, the amount of money across our population is significant. So and beyond that, we actually have a duty under the Care Act to act in preventative ways. And this is, I think, probably one of the greatest or the best manifestations of acting in a preventative way, by supporting local small grassroots projects to do things in the right way with their local population, rather than, you know, through our direction from a sort of centralised view of what makes people's lives better. So it is that real sort of, you know, transfer of democratic availability to do things very, very locally.
Thank you. Councillor Briggs.
Thank you, Chairman. Peter, I certainly agree with the proposals, but a couple of questions, please. If someone elderly is suddenly presented with an iPad or a computer, does anyone check that they can afford broadband? Do they know how to connect it? Are they given any advice on how to use it?
Yeah, so our project will be providing some of those skills. More widely, we are working with partners in the voluntary and community sector to work out how we can deliver that more digital offer more widely. It is available already in the community, and there's organisations that are set up for that. However, we also recognise that often people access support and advice from people they already trust. And that was almost evidence on a familial perspective in terms of our very much had a huge impact in COVID, our Get Your Granny Online campaign, as it was called, which had big resonance in terms of the feedback it had in terms of giving people support to do that. We're then looking to do similar in terms of working with our voluntary and community sector organisations to embed digital champions within their existing schemes to give people those skills. In terms of the equipment and the Wi-Fi, that can be a barrier, but we're looking to work with organisations that look to how we can circumvent that and get them online. Many voluntary sector organisations are getting funding from other sources, and that's providing things such as those MiFi, or there's small Wi-Fi hubs for them to connect to services to access information and advice. So it's growing, and we're very much working with partners, not just in the voluntary and community sector, but across health to make sure that we tackle that issue.
Thank you. May I just have one more?
Yes, certainly.
Thank you. Just a quick one. Community centres, do they have, do they know where they can apply for all these different grants? Because often in one of mine, which is in an area of great deprivation, and they want to rent out their rooms for their own sake, but they're asked if, I think one was dancing and exercise for elderly people, but they turned it down because they couldn't find a grant to enable it to go through. How do they know?
In terms of funding, we obviously advertise ourselves, and when we put our regular posts to ensure that people are aware of that. In fact, not this time, but the last grant awards we made in January time, we had 2 which went to community associations for that sort of purpose. We also work very closely with the district councils and also the CVSs, which is the Council for Voluntary Services, which are umbrella organisations which very much most of the community associations are part or members to. It usually doesn't cost anything to join, and they will help also communicate those messages about funding, as well as providing direct funding support to them in terms of how do I get funding for this, and what have officers who can guide them to most appropriate source of funding should they require it. We will also support those individuals and those organisations should they come to us to make sure we see if they're available for our funding, or if not, signpost them to other funding or other people who may be able to provide them with funding or resources to get that funding, to ensure that they have the best chance of success and providing the service moving forwards.
Thank you very much.
Thank you. Councillor Tustin.
Yeah, just a couple of points. Number one, it's considering the uptake of things like the IT reboot, because I know there is a sort of a potential impact that, how many people do. So we already talked about, I think it was Councillor Carpenter talked about making sure there is sort of an audit to make sure how effective it is. But the other side of it is that a minor concern is the fact it's talking about repurposing old kit. So it's ensuring that that kit is fit for purpose and has some sort of longevity, because obviously if it's just bunches of very old laptops that then die after 6 months or have wonky keys that don't work and things like that, that's actually going to be more of a hindrance than a help.
Yes, and we've spoken to in terms of in terms of how we do our grants, we don't just take applications in, we work with the applicants in advance to understand more about what they're looking to apply. We know they've worked closely with an organisation, the Fleet Lions, who have been doing this already, and we recognise and understand their structures, and they're looking to implement similar best, in terms of their quality control on the IT equipment they're taking in for repurposing, but also their ability and the software they're using to wipe it, to make it sure it's clean and to make sure it's in a serviceable way moving forwards. So yeah, and equally the idea is there'll be other equipment there, so even if there is a fail, they've got an ability to go back to the organisation and say, how do I get this wrong? And it could be that they can always get another piece of equipment to do that, not that we're expecting it to fail within, say, about 6 months to a year period, but if that was an issue, it's covered off in terms of how their way of thinking about it.
Right, I see Councillor Humby's here. We're very honoured, Councillor Humby. I just wondered if you wanted to ask any questions.
Chairman, thank you. Thank you very much. It's very interesting. And I was just curious in my efforts to sort of look at joining up the dots across the whole authority, and it's linked to the last question from Councillor Tustin. How do we sort of link up organisations like this, or do we, with things like, I'm talking about the IT equipment, with the smart living programme we have internally and the waste prevention? So, there's some synergy there, and I'm just curious as to whether we do that internally when you get requests for this sort of equipment. Thank you, Madam Chairman.
We are doing that in terms of some of the other work. There's more work to be done on that, Councillor Humby, but we are working with other departments, whether it be CCBS, but also our colleagues in ETE. We've got a good relationship in terms of waste management anyway, about how we can best utilise resources elsewhere in the council to make sure we can provide these services to the most vulnerable, whether it be about how we can get that waste management perspective, or it could be in some of the CCBS, it can be about the training can be provided via libraries. So it's a whole range of things, as well as the broadband programmes which are going out. So we're very much looking at it as a cross-council perspective. We're also working with colleagues in children, so that same way, recognising that the issue of digital enablement isn't just about older adults, it also affects children as well. So how can we, and the whole family, so we're very much taking a whole council approach in some of our work going forwards, and linking to senior officers from CCBS in terms of how it can also inform our digital strategy.
That's really good, and Liz, if I may then, and thank you for that. It might be something that's interesting that you could signpost some of these organisations to those other internal things that we're doing. And it might be a good idea, Liz, in terms of if we kept maybe Councillor Warwick in the loop about some of those joining up in terms of recycling and waste as well. It was just trying to bring everything together, but thank you very much.
Thank you. Graham, did you want to come in at that point?
Yeah, just specifically, I think it's something that we, as across department as officers, we've been considering and doing for some time. So those kinds of synergies. So for example, Peter and colleagues have a demand management and prevention group, and we have representative across the council joining that group in terms of what can we further develop. And indeed, I think probably over the last, I'm going to say 2 to 3 years, I can't remember precisely when it started, but there's been officer challenge sessions that have been had. So as we've gone through each of the transformation programs, each department has brought senior officers together in order to challenge around any particular transformation ideas in terms of how much further can we go. And I think as a result of that, what we've been able to see, and there's a huge amount of synergy. So IT, I think, is a really good example in terms of it's not just about kit, it's about people's ability to be able to use it. It's also about the broadband infrastructure. Frequently, the key issue about the black box is the kit. It's about, are they suitable for web browsing rather than any other more complex applications. And actually slightly older machines are fine for that as long as people know how to use them and they've got a good broadband link. And we've been able to do that across departments in terms of working principally, but not only with CCBS, but making sure that we're constantly both challenging and checking with each other across council departments in terms of work we're doing is in line with other departments and vice versa. And similarly, that we're not doing something which is counter to what other departments may be stopping doing. So all of those things have to be brought beautifully in sync. As Peter has said, we're not there. It's not a well-oiled, perfectly configured machine at the moment, but we're working really hard to get it to that point.
Thank you, Graham.
Excellent.
Councillor Withers.
I'm just touching on what Graham was saying there about the IT equipment. I mean, organisations like OpenSite, which obviously have the special screens for people with obviously sight difficulties and dyslexia, you know, where you've got the yellow screens with the black letters. I assume you link in with them as well, so that not everybody obviously is the same in the use of technology. There are different demands pertaining to the different types of individuals.
Yes, and we recognise that. And again, not only in terms of what we do, but our community teams do. They will look, especially our Sentry teams, will link into organisations such as OpenSite to make sure that those individuals can get the right support they need to access online services, whatever they wish to do online.
Thank you.
Okay. Right, Peter, that was a bit longer than you expected for you today. Sorry about that.
That's good.
Good. Very happy to approve all these grants, I think.
Thank you.
Thank you. Right, last item is the appointment of people to the various trusts. I think the paper is perfectly self-explanatory. Councillor Humby, I see you're going back on Southern Health.
Yes, I am, Madam Chairman. Thoroughly looking forward to it. I have to say, I do really enjoy it. They've been through a very difficult time, as you know, and I speak with the Chair, Lynn Hunt, on a regular basis. I'm meeting her on Friday. So thank you for reappointing me on that. I'm very grateful for that. I do enjoy it, and it gives me a different perspective right across the whole council as well, so which I think is good value for all of us. So thank you.
That's my pleasure. And Councillor Briggs, you're still happy about being on the Portsmouth Hosp?
Yes, I am. I think it's a good opportunity. Whether they're pleased to have me or not, I'm not so sure. But yes, thank you, Chairman.
No, well, thank you for volunteering for it. Thank you. Okay, so happy to approve the appointments and thank you all for coming. Okay. Bye.